Good morning. It's an honor to be here. I'm very humbled to be here with you all today. It's very exciting to be in your company. When Lauren kicked things off, I was just, it's like, these are my people. This is what we do. It's tremendously exciting to hear all the different perspectives, and obviously we come from the nonprofit perspective in delivering these programs versus the research perspective, and to see where the alignment and the overlap is not only with different programs but different approaches is tremendously exciting. So I have learned a tremendous amount already, and I'm obviously honored to be in the company of David and Carolyn. I have spent the last 14 years of my life leading this organization, and the two programs for which we advocate are theirs. And so it is, it's just an excellent day to be able to be with them here today, as well as with all of you. Okay, so if Carolyn says she's challenged, I for sure am challenged, because she presents a lot more than I do. So I'm going to hope I don't mess this up. So I was asked to speak a little bit about how Invest in Kids came to be, because it's a unique beginning, if you will. We were founded by a group of lawyers and community leaders in the Denver area who'd been doing a lot of work on behalf of a group called the Colorado Lawyers Committee, which was a group that paid dues to belong and then donated their time to different pro bono efforts working with disadvantaged families in the system. And this group of volunteers met for 2 years talking about how little Colorado was doing in the area of prevention, but yet they were called in after the fact, and frustrated by how little our lawmakers were doing to incentivize and support primary prevention programs in our state, and finally made a decision to either stop talking about it or do something about it. And so, in fact, they did. They came together and discussed what it could be that they could contribute to our landscape in Colorado that would serve this purpose. And they talked about a ballot measure, they talked about a tax. There were a lot of different ideas running around. And being attorneys, they had a strategic approach. They were very well connected, but they knew absolutely nothing about early childhood. So they had a lot to learn. And this is a quote that our organization lives by: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." And that is the case in many of our lives here. So they decided at the end of the day to form a nonprofit organization, and that this nonprofit was going to have the broad mission of improving the health and well-being of vulnerable children. And we were going to do that in partnership with local communities. We were going to identify programs, introduce them to local communities, help to implement them, and then ensure their success long term. So our approach, identifying evidence-based programs, it was one that at that point didn't have much of a blueprint. Today we benefit from a lot of resources, but this was 1998. This group was not entirely sure about how to go about this next step, but did devise an approach that they followed, which was meeting with local leaders throughout our state, ascertaining where the greatest needs were for services, targeting a national search based on meeting those identified needs, focusing on prevention programs, given that that was our intention, serving predominantly low-income children, starting prenatally through age 8, and to focus on programs that had the evidence, not only to show their impacts to these families, but ultimately show the cost benefit to return to society. This is something that we have, a joke, if you will, a cartoon. For a very brief period, medieval scientists were known to have dabbled in the merits of cardboard armor. And when we started using this Larson cartoon in the late 90s, early 2000s, it was a novel concept to use evidence-based programming, and this was kind of our way of breaking the ice on the Eastern Plains or the Western Slope about why it was that these do-good lawyers from Denver had shown up wanting to educate them about a different way of doing things. And when I was reading the scope of this forum and the work that you all are doing together, I was reminded that, in fact, we could have another Larson cartoon talking about implementation science, because it's been a long time in coming with our groups that we've been talking about evidence-based programs for a while now, but only implementation science for a short time. So we're headed in the right direction. So I'm going to talk very little about the programs. You obviously heard from Carolyn and David. We adopted the Nurse Family Partnership in partnership with David in 1999, the incredible years in 2002. I've been asked to speak today more on the history of the organization and then how we operate today. So the Nurse Family Partnership will be the example, if you will, as it relates to how we got up and running, which was asked to be my focus. So introducing these programs to communities and constituents, our focus very much is around working with a broad base of community support. We were founded by a group of people, Bill Rosser, our main founder, who was active in the civil rights movement in the South in the 60s and very much believed in getting to the heart of the matter with the locals and really operating from both a grassroots and a grass tops place and not coming from top down, but instead community up. And so in fact, we went out and started bringing together broad-based groups of people. And because the Nurse Family Partnership has such breadth and depth to its impact, we could pull together lawyers and judges and police officers and social workers and health departments and education systems. And everybody knew that if we were successful in delivering this program, in fact, we would be impacting their caseloads down the road. And so a lot of people had read David's research and the JAMA articles and all the other places that he was published. But this was 1999, and David hadn't yet taken it very far outside of the research setting, with the exception of the Department of Justice, Weed and Seed Sites, and a handful of others. And so people were tremendously excited that this nonprofit had come to really bridge the gap between research and practice and play the intermediary role of being able to partner with David and ensure that local communities had access to his program and could deliver it with quality. And those broad-based community folks were the ones that looked at the existing continuum of services and made a decision about whether or not there was an existing void that we could fill by way of bringing this program to them locally. And so we literally hit the road. I mean, we went out very intentionally to our frontier communities, to our rural communities, not just our urban centers. We met with these broad-based groups of people, and we were unique messengers. We were lawyers who were coming into their communities talking about what we knew was best, whether it was about child abuse and prevention or it was about school readiness and self-sufficiency, and got an audience with these folks. And I remember the story of a public health nurse down in the San Luis Valley who called up to her state health department contract and was like, okay, there is a group of like 2 good lawyers hanging out, and we want to know if they're real. Like, what is the story? And not so sure that they could trust what they were seeing. But in fact, in the first 9 months of our existence, after partnering with David, and I'll speak to that in a moment, we had 6 communities that had adopted his program to the tune of about $400,000 a year in these local communities to deliver it to 100 families. And that only took us 9 months because people were ready and waiting for his program and tremendously excited about the opportunity to bring it. And so when I talk about what we know about broad-based community support, I've highlighted a few things here. We may have prescribed models, but we are also very responsive to those community needs. But without the respect for that fidelity, we will struggle to be successful. Obviously, having the diverse stakeholders leads to coordination, less duplication. We were very clear about not wanting to overlap with existing home visitation programs or other programs working in ways that would be duplicative, but instead aligned. And then obviously talking about sustainability from day one. That was a given and happens with great thought in the pre-implementation process, because it's not only about the political support and the local leadership, but obviously maintaining a quality product long term. So we went looking for a proven program initially. The exciting thing here is that we tripped over David in New York. We were based in Denver. At that point, he was running his 3rd trial. The Colorado Trust, a large funder in our state, had funded about $9 million to David's 3rd research trial that started in 1993. And now this was 98, 99, and one of our founders was in New York meeting with someone, and they said, you need to pack your bags and go home, because the best program we know about is Dr. David Old's Nurse Home Visitation Program in Denver before it was called Nurse Family Partnership. And so, in fact, we headed home, met with David, and obviously that's the work that predated are getting those 6 communities up and running. It was after David and the founders of Investing Kids had incorporated our nonprofit and in fact were ready to educate communities about the availability of this program. But what David and our founders and the 2 staff people at that time realized was that it was going to be more than just educating people about the availability of this program. That was enough to get folks up and running initially in the 6 counties where we were successful in doing that through TANF dollars and federal safe school dollars and a whole host of different funding sources. But we had 2 major issues that we had yet to consider, and that was long-term sustainable funding, and in many ways the sustainability of the clinical work. So we hired the first nursing consultant in the country for Nurse-Family Partnership to support folks once they came home from training. And we also met with 80 of the 100 legislators prior to the 2000 legislative session, realizing we needed money to do this work well. So we started that process at the state level with a proven program. So we had 30 years of research. We had a cost analysis at that point done by RAND, has since been replicated by others. And we had the clinical information system, which was the data system, now Efforts to Outcomes, a multi-million-dollar web-based system collecting data on all the nurses in our system. And so we were able to sell it to the legislature on those 3 points. But it wasn't just about the program. The program's what allowed us in the door, and then it was us lining up with a whole host of other folks that were looking for dollars. So the next thing we needed to do was to really utilize the founders of this program, which were very well respected attorneys and community leaders in our state who weren't traditionally advocating for early childhood prevention programs, let alone programs with an evidence base. After getting our 6 communities up and running, we decided that this grassroots work needed to happen to affect state funding, and therefore we established what we call Investing Kids Action, which is our 501c4, to work alongside our 501c3, given lobbying limits and things. We hired a lobbying firm who's still on retainer with us today, 15 years later. And we identified a legislative champion. And so it really were those components that lent itself to a collective success in '99 and 2000. We met with the legislators, educated them about this program, and as I discussed, the research, the cost analysis, and the accountability. One of those legislators happened to be Senator Norma Anderson, who was very well-respected Republican, which was the majority of the Senate, House, and our governor's office were all governed by Republicans at the time. Her mother had benefited from a home visitor in the 1930s in Ohio and talked about it until the day she died. And Norma was carrying the bill that was going to decide where $2.9 billion over the next 25 years was going in tobacco master settlement agreement funds for our state, about $100 million annually to Colorado. And as you can imagine, we were one of about 600 programs that lined up for that optional funding that was essentially general fund dollars coming into our state. And having the capacity of all of these different approaches, what ultimately gave us great success in working to pass what's called the Nurse Home Visitor Act. We wrote this bill to ensure that the state was the fiscal agent, but that the University of Colorado, where David's Prevention Research Center was based, was the programmatic lead. So it's a dual approach. So David's shop, subcontracted to Investing Kids, has all clinical and programmatic authority to ensure quality, and the state runs the money. As you can see, it was tremendously successful. I don't expect you to be able to read all these little numbers, but what it talks about was that we started very small. We were offered $19 million a year from day one. We chose to take $2 million and take 20 years to get to $19 million. So what we wanted to do was build on a strong foundation. David knew that we didn't know how to implement this program well at this scale. Over $130 million in state funding has been dedicated to this program since day one. We have a $15.6 million line item this year. And as you know, one legislature cannot bind the next. So it is a tremendous challenge, and ultimately has been a tremendous victory every year to maintain this largest optional prevention funding dedicated in our state's budget. As you can see, as we get a little bit further out, McVie starts to come in to join Medicaid as well as tobacco dollars. We have McVie funding, both formula and competitive, in the state of Colorado, dedicated to multiple programs, but the majority of that funding going to Nurse Family Partnership. We now have a presence in 60 of our 64 counties. With that said, the only 4 counties that we don't have a dominant presence in is simply because of their population, and should there ever be a first-time birth in that county, they have access to their adjacent neighbors to provide them. So I am proud to say that we do not have a single legislator who does not have a constituent benefiting from this program. Total capacity right now is at about 3,300, which is at about 20% of the penetration rate of first-time Medicaid moms in our state. Implementing these programs through agency partnership and community collaboration has been talked about quite a lot. We work with a group called the National Implementation Research Network out of the University of North Carolina. Many of you have probably seen this formula, but what it acknowledges is that you have an effective intervention, and that's only one piece. Implementation methods and the context in which you're working all equate to the significant outcomes you're looking to achieve, and it is a multiplication formula. So anything times 0 is 0. This is there's lots of triangles. I'm sure you're all familiar with Dean and Karen's work, but this is what we utilize, both with the Incredible Years and with the Nurse Family Partnership, really looking at all the different drivers that are, as it says, integrated and compensatory, and the role that Investing Kids as an intermediary organization bridging this gap between research and practice plays in all these aspects of the work, as we partner with developers as well as our end users. And I stole this from Jennifer Schroeder with the implementation group, and it says, "I'm back from training, I've got a big binder, the training is already forgotten, but the binder will last forever, a living monument to temporary knowledge." And so what it really acknowledges is the absolute critical nature of the ongoing consultation. This is some Joyce and Showers work that you all have probably seen, which just speaks to the need for coaching in the classroom. We utilize this in our Incredible Years presentations, working with Dinosaur School and Teacher Classroom Management, which is essentially acknowledging how critically important it is for the long term to stay invested in a consultation role to ensure the quality is sustained over time. One of the things that you saw earlier was sort of the left side and the right side of the pyramid here, the organizational drivers and then the competency drivers. Obviously, the selection, training, and coaching is what we've talked a lot about. The organizational drivers gets a little bit less play, I feel like. But one of the things that Investing Kids was wise in doing, along with our initial funder, which was the Colorado Trust, David's third research trial funded by a foundation who, seeing those outcomes, had a very vested interest in that program scaling in Colorado, and gave Investing Kids an initial grant of $3 million over 10 years to get his program up and running. This is some work that we did from day one, which was essentially to look at what the broad-based community process meant to the long-term outcomes of the program. And to quote David, around 7 to 8 times more likely for clients to leave when nurses leave. That's exactly what we found. We found that when you have buy-in at a community level, you have buy-in at an agency level, supervisor, and ultimately it has a direct impact on that dyad, on the nurse and the client. And what it ultimately meant was that where we had a strong, authentic community process where people felt a sense of buy-in, based on the facilitated approach that Investing Kids took, we had stronger nurse retention, which meant we had better client outcomes. And I am, okay, so I need to move faster. So NFP, we've done great, 17,000 moms, tremendous outcomes, very consistent with the trials, same with the Incredible Years, over 35,000 kids have gone through our program, 3,200 parents. Again, consistent outcomes. This is the best part, and I will talk about it briefly, but really the ongoing consultation and quality improvement is where we live today. So I know they wanted me to present very much on the history, but I will also say that what's tremendous about the third-party role that we play is that we can identify gaps at the local level and then look to fill those gaps. So we had an issue around nurse retention. We created the Nurse Practice Council, which is based on the Magnet Hospital concept, with bringing 14 nurses for 2-year terms together to affect their outcomes. We're seeing increases in nurse retention. We're seeing better client outcomes as a consequence of their sense of buy-in. Invest in Kids, the Incredible Years peer or competency coaches, not to be mistaken from the accreditation process that Carolyn has. We actually had struggles how we were going to sustain this program over time. Because we were concerned about the level of the quality should we ever back out of the classroom or the parent group. So now we have 17 peer coaches around the state that are moving the quality in the direction we need them to. I think these values really speak to the culture of Invest in Kids, our founders, what we've carried over the last 15 years, that ultimately lends itself to being a strong partner both with developers and with local communities. And at the end of the day, why do we really do what we do? We look to fill children to the brim with praise, love, and laughter and self-confidence, stir in generous quantities of hugs and kisses, slowly mix it together, and served up a well-adjusted human being. And that's what we're all about. There's awards associated with implementation and evidence-based practice coming together, which I think is very exciting for all of us. These are places that both of our programs and our work have been recognized, and that's it.